And the outline of my talk will be, what do you mean by hectic fever? What are the fever patterns tell to us? Or fever patterns are relevant today in clinical practice? Some case snippets and message from case snippets, and finally the PEO on hectic fever. First of all, I was thinking why Dr. Jagdish has given me this topic of hectic fever. When I gone through the literature, even the Nelson gives 1 or 2 lines here and there very rarely. So everywhere you don't have enough literature on hectic fever as such, but still this topic has been given to me. But let us see at the end of this lecture, what is the importance of this hectic fever in pediatric practice. And as late as 2nd century, the Galen Roman physician has been mentioning about the hectic fever as the patterns of the fever. So what do you mean by hectic fever? Any high spiking or wide swinging or highly fluctuant fevers with a 2 to 5 degree difference between the peak and the nadir is known as the hectic fever. And what does the adult physicians mean? Usually they mean that some serious suppurative infections are there. So this is the reason, and usually they ask, particularly when they ask us, particularly as a pediatricians, sir, my child is running hectic fever, whether anything serious is to be. So this is the common question by a general practitioner or a general physician to a pediatrician. So what does it mean to a pediatrician? So the 2 important questions to be answered at the end of this lecture is, how common is hectic fever in children? What is the utility value of it in day-to-day practice? So this is the essence of this lecture. Okay. So coming to the fever patterns, we know fever patterns has been dating back to as during even the Hippocratic days, the malarial pattern has been described. So fever pattern has been appreciated for centuries by clinicians as an important diagnostic science. When methods for diagnosing infections were primitive or non-existent, this analysis of fever curves often provided the only way to differentiate acute febrile illness. And particularly when there are no localizing signs, the temperature analysis and the characteristic fever patterns are of clinical importance and may provide the only clue to guide further testing or suggest a diagnosis. This is true particularly 100 years back, particularly before the antibiotic era and before the antipyretic era. What do you mean by fever patterns? And the fever patterns as such actually taken a great role only after Professor Wunderlich from Germany, who has recorded more than 25,000 patients, who has recorded the graphs, and finally he has analyzed more than 5 million temperature, and finally he has come out with the thing. So only he is known as the father of clinical thermometry. So what are the common fever patterns described in the literature? The former are intermittent, remittent, continuous, and hectic and relapsing. The hectic fever is one of the fever pattern. So before going to the hectic fever, we should know about the other fever patterns too. So when it comes to sustained fever, usually the temperature variation is less than 1 degree Fahrenheit. Some tests say some less than 1 degree centigrade. There is no fluctuation. Then it is says a continuous fever or a sustained fever. But whenever the fever touches the baseline and the temperature variation is there, every day there is a temperature peak, but it touches the baseline, it is known as intermittent fever. Whereas whenever the temperature doesn't touches the baseline and the fluctuation is more than 1 degree centigrade, it is known as remittent fever. So what do you mean by hectic fever? Whenever there is a wide swings of temperature each day, more than 2 to 5 degrees centigrade, it is known as hectic fever. Here again, there are further graphs to explain this thing. The first one is the intermittent fever graph. Here you can see there are temperature swings going up to 104 degrees centigrade, but touching the normal to 98. This is the intermittent fever. Every day the temperature touches to normal. So this is the classical example of malaria, like a quotidian fever, tertian fever, quartan fever, everything comes in the thing. Coming to the second, here comes the remittent fever. Here you can see the temperature goes up to 104 or 103, but it doesn't come below 99. That doesn't touches the baseline. This is known as the remittent fever. Usually majority of the viral illness we face in day-to-day practice are mainly comes under this category of remittent fever. Coming to the third graph, you can see this is a graph, this is a step ladder pattern, and finally the temperature becomes a continuous or sustained fever where the temperature variation is less than 1 degree centigrade and it keeps going on. This is known as the continuous fever. But These days are pre-antibiotic era and pre-antipyretic era. Now the people are so notorious in using the antibiotics and antipyretics. This continuous pattern fever and all doesn't exist because of that is the very potent antipyretics or potent antibiotics. So the temperature is made to come down to normal. These continuous fevers are everything becoming an intermittent fever nowadays. So they are becoming irrelevant as days passes on. So here again, I have shown the intermittent fever and remittent fever thing, but here there are wide swings of temperature, more than 2 to 3 degrees centigrade. So here you can see it goes from the 99 to 104. Here you can see it goes from actually 100 to 103. So wide swings of temperature, whether it is a remittent or whether it's a intermittent, they are known as hectic fevers. So what does hectic fever means? Whenever there is a wide fluctuations in temperature, whether they reach the baseline or doesn't reach the baseline, then it is known as hectic fever. This is the thing. Here is again, there is a representation of hectic fever showing the wide swings of temperature. Okay. So in clinical practice, what does it mean? So now the many typical fever patterns are rarely observed. Why? Because of the several confounding factors. We all know the age of the patient, the immune status of the patient, what is the physical malnutrition of the patient, and antipyretic use, antibiotic use, and many confounding factors. See, they doesn't allow these fever patterns to appear in day-to-day practice. For these reasons, the utility of fever patterns in clinical diagnosis is often limited. This has been stated as early as 1980 by actually Mosher et al. So the clinical pattern is getting less and less relevance in day-to-day practice, even for an adult. Then what so about children? Definitely, they are having a very less significance in children. What about, so if the fever patterns are of not of significance, what do about the height of the fever? Even the height of the fever, there is a weak correlation between the height of the fever and severity of infection, whether it is a viral or bacterial. The overwhelming majority of high fever is caused by viral agents. So even the height of fever doesn't make any significance. Then what about what is significance? So if the pattern is not significant, height of fever is not significant, what is significant in day-to-day practice? Only the clinical appearance, the level of alertness in behavior help in determining the child is serious or not. And so the focus of the parents and physicians should be on the child's appearance and behavior, not the height of the fever. So in summary, as Professor Amdekar says, particularly whenever it comes to fever, you should analyze in the pattern whether it is a high fever or a low-grade fever. It is not. It is only the onset and progress of the fever, whether the child is responding to antipyretics or not, and behaving during the interpretal period of and toxicity and vitals. For example, if it is a high-grade onset and the child is responding to paracetamol, and in between the fever, the child is playing around, the child is not looking toxic, definitely we are dealing with a well child, most commonly a viral infection. Whereas even if there is hectic fever, but if the child is toxic and the child is not behaving well in between the temperatures, definitely we say something is fishy and serious bacterial infection has to be ruled out at any cost. This is the summary of the, particularly when you are applying to day-to-day practice. Then what is the fun of discussing this topic? And definitely whenever Dr. Jagdish gives, there is some sense in the topic. And when I go through the thing, whenever infants and young children are more prone for particularly making the fevers high as well as prolonged, more rapid temperature increases and greater temperature fluctuations. Almost all short duration fever we see in pediatric age group are particularly the 3 to 36 months are hectic fevers. Hectic fevers are common. So that is the reason this topic has been given. So what does it really mean to me? Whether it really means that unlike particularly it has told already, hectic fevers means it is mostly septicemia, mostly endocarditis, mostly abscess, toxic shock. Is it true always? Is it true always? Let us go through these case snippets. Here is a 8-month-old baby with a high spiking fever for 3 days. On examination, the baby is not sick looking, the vitals are stable, but still because of the parental pressure, we go along with the investigation. Urine is the normal, that is the first investigation. Then the CBC shows leukopenia with other cell lines normal. On day 4, but we told the patient to wait because there was nothing in the investigation. But the next day, the fever settled with the appearance of the rash. We know the diagnosis roseola infantum. So here there is a high spiking fever, but what does this mean? So viremia can cause high spiking fever. This is a second case. Here is again an 8-month-old with high spiking fever with rigor of 3 days duration. Mother says the child shivers a lot whenever the child starts getting the temperature, which is a high and spiking. On examination, the child is looking sick, and in between the paracetamol, the child is also not looking good. But there are no other localizing signs. On examination, find out to be the child was having urine plenty of pus cells with neutrophilic leukocytosis. Mostly we are dealing with a case of serious bacterial infection, that is pyelonephritis. Here is a bacterial infection with a hectic fever or high spiking fever. Okay. Case number 3. Here is again a 8-month-old infant with a high spiking fever of 5 days duration. The child is irritable all the time, incessantly crying. And so on evaluation found out to be a neutrophilic leukocytosis with CRP in hundreds, but you are not able to find out other common serious bacterial infections, meningitis, pneumonia, and all other infections are ruled out. Finally, it turned out to be a Kawasaki disease. What does this mean? The high spiking fever can be a feature of a toxemia or a super antigenemia. Here, the super antigens are known to be the cause for the Kawasaki disease. So finally, what does a hectic fever, unrelenting fever means? That is, what are the most common etiologies in day-to-day practice are any viremia, whether it is a measles or roseola. For example, on the other day, I had a friend's wife calling me that my child is running 104 fever. What does I do, sir? So I told first 48 hours the child is looking fine. Don't do anything. Give paracetamol. The next day I got a phone call. Sir, my child is having plenty of oral lesions and drooling of saliva. It is nothing but HFMD. So even a simple viremia of HFMD can cause a hectic or unrelenting fever. And bacteremia can cause high fever or hectic fever. Occult bacteremia is known in the pre-vaccination era. Now it is coming down and down. We all know septicemia presenting with the hectic fevers, and toxemias like scarlet fever and Kawasaki, and finally parasitemia, malaria. So in short, all emias, viremia, bacteremia, septicemia, toxemia, parasitemia can produce hectic or unrelenting fever. So what do as a practitioner I want? I want to know whether I need only a supportive therapy or antibiotic therapy. When it comes to hectic fever, definitely it is not useful in differentiating the thing. So the utility of value, application value of hectic fever is not much, not of great significance in short duration fever in children. So how aggressive the approach should be? This is the second part of my question. Hectic fever plays no role in the management approach. This is the final statement. Unlike an adults who ask whether I should give antibiotics, hectic fever doesn't play any role in the differentiation of a viral and bacterial infection. Only if the child is sick and toxic, be aggressive in evaluation. If child is non-toxic and well-looking, conventional conservative approach is the norm. If the baby is well-looking, look for the focus or no focus. If there is no focus and well-looking, just paracetamol for 48 hours, no investigation, no antibiotics, evaluate only after 48 hours, whatever the hectic temperature the child may be having. So this is the way the approach should be whenever you come across a hectic fever. So then the next question is, what about the role of the hectic fever in the PUO? Definitely in a controlled environment, when you are admitting a fever in a particularly a child, a PUO in a hospital, definitely fever patterns are useful in pointing to or establishing a diagnosis in children with FIU. However, the character of fever also can be helpful, particularly when you are having a high spiking fevers. Definitely it indicates mostly you are dealing with a sepsis related to liver, kidney or biliary tract, or infective endocarditis or occult abscess anywhere, brucellosis, rat bite fever, malaria. Unlike a low-grade fever, low-grade intermittent fever, it can be extrapulmonary tuberculosis. So definitely it gives a clue that something you are dealing with this in these lines whenever you come across a case of PUO. So definitely a hectic fever plays a role beyond 7 days of fever. Less than 7 days of fever, hectic fever doesn't mean anything doesn't mean much for a pediatrician, whereas in case of PUO, definitely hectic fever plays a major role. So finally, what are the take-home messages? What about the fever patterns? Fever patterns still play a role in reaching a diagnosis for an obstetric clinician wherever, particularly when it is applicable. Hectic fever in infant and young child is the norm. But during consult, hectic fever doesn't play a major role in diagnostic and management approach. Only the sickness and toxicity decides everything in short duration fever, not the hectic fever. Whereas in case of PUO, certainly hectic or high swinging fevers point towards certain specific diagnosis. Now you will come to that thing, final norm. The answer of the question is, how common is hectic fever in children? Definitely very common in day-to-day practice. It is the norm in 90% of the or 80% of the children. Then what is the utility value of hectic fever? Definitely it is not of utility value in young, not of utility value in a short duration fever, whereas it is a utility value in a PUO. Thank you one and all for the opportunity. Thank you very much.